more down and you say, hey doc, I'm great, I want to get more into nutrition, I want to get a little more deeper into this, then we'll go from there. But start with this foundation and then we'll break off from there. And I got a couple guys I can send you to if you want to get deeper into that stuff. If you want to go further than that, if you want to get into deeper into exercise, your personal trainer and stuff, let me know. I'll find that stuff for you if you can't find it on your own. But start off with this. Consider this your base foundation, and from there we can grow once that becomes habit. Okay. Any questions at all?
So tell me, particularly with your brand of chiropractor, how do you decide on a patient when to refer them, right, to another healthcare professional?
If there's any life-threatening condition there, obviously, if it's a heart condition or a cancer, unfortunately, I see a lot of those actually nowadays. I immediately refer those out. Now, I tell you, I continue to treat them as a patient. I try to keep them as a patient because.
No, but I mean, with something that you would normally treat right?
Let them go. Just when the patient gives up, when the patient says, "Okay, I want to try something else," and again, that's within reason. Like, let's take for an example. Let me give you an example. If we got a hot disc patient with a herniated disc, okay, if they come in and I see that they're starting to lose size in their muscles, and they're getting foot drop, I'm going to probably refer that patient out, okay, pretty quick, okay, because that's turning into an emergency situation. If we don't do something, they could lose the use of that leg, okay. If they have a hot disc and they're not losing any type of motor function, they're just in a lot of pain, I'll stay with that patient as long as they want me to, all right, because that can take a long time. Now, I herniated a disc in my neck. It took about 4 months probably before the severe pain went away, all right, and I've had a patient in particular that did have foot drop also. I actually tried to refer him out and nobody would take him. He was an illegal Mexican, illegal alien, and nobody would take him. I referred him out to 3 other doctors. Every single one of them just sent him home with a prescription and wouldn't treat the guy. If it would have been anybody else, they'd have done surgery on him immediately. Major foot drop, losing atrophy. So I just kept working on him because nobody else would take him, and pretty soon we got him better. I mean, his leg, he's got full strength back, got all function back. So I'll stick with a patient as long as they want, because again, it's not. And this, I'm glad you brought that up because I want to hit this. These 4 things. It doesn't matter what condition you're in. When my dad was diagnosed with colon cancer, guess what I told him to do? You need to start working on your mind and spirit. You need to start eating right. You need to start exercising. You need to go to Dr. Lovett because I wasn't here at the time. And you need to start getting adjusted. Okay. When I have a patient comes in and says, "Doc, I know somebody that's got Parkinson's disease. Can you help him?" Yes, I can. Get him in here. We need to start working on his mind. We need to work on his nutrition. We need to work on his exercise. We need to start adjusting him. Does that mean adjusting is going to get rid of his Parkinson's disease? No, that's not what it's about. It's about getting his body as strong and healthy as it can be. If he needs sick care, if we do need to refer him out, he still needs to be doing these 4 things. Yeah. He still needs to be working on his foundation, because if he does have to have a surgery or take some medication, you want that body as strong as possible so it can recover from that surgery. You got to understand, if your body's not strong, the surgery will kill you. All right, you cut the body open, you're risking it. All right, you're risking infection, you're risking heart attacks, you're risking all kinds of stuff. So you want the body as strong as possible. So I'll treat a patient as long as they want. As long as they want to keep coming in. Now, I will quite often say, look, I think this is a condition we need to get medical consult on. We need to get some orthopedic or neurological evaluation on or something to get some more opinions on, and I'll refer them out, but I'll keep working on them. Now, if they want to just go completely that route and stop with chiropractic for a while, that's good also. I really try to work with the patient and do what they want to do and talk with them about it. So I'll throw other options out.
Tell me, in your experience, what pediatric illnesses have responded to your treatment?
The most common ones are ear infections, without question. I mean, ear infections are just so easy. I mean, they just respond so well to chiropractic in kids. Recurrent colds and stuff like that. You see babies or kids that are just constantly sick. Go ahead. They respond quite well. You quite often, some of the more dramatic cases, you have these. One case in particular was a kid that came in that we really didn't know what was wrong with him. He was just sick, and very sick. And he had actually been to several medical doctors. They actually had just done a liver biopsy on the kid. We adjusted him, and he immediately showed improvement. Immediately. Now, again, we still don't really know what was going on, because even with the liver biopsy, it never came up with a diagnosis. But the most common things are ear infections, childhood colds, recurrent colds and stuff, headaches. See a lot of kids with headaches nowadays. I mean, just rarely can we not get rid of a tension-type headache or a migraine-type headache, as long as there's not something else going on, blood sugar-wise or something like that.
Are you aware of a mechanism of action, right, that explains that? Are you improving the performance of the immune system, or why do the colds and flus and so forth?
The immune system, without question. Yeah, the immune system and the nervous system are closely related. If you interfere or weaken the nervous system, you're going to interfere and weaken the immune immune system without question. Now, on ear infections, there's also a mechanical component